Then there is viral Wart. Wart. Probably all of us at one point or the other have been affected by warts. Yeah, and they're usually viral. That is caused by viruses. So they're called in a more fancy term, Verruca vulgaris. Yeah, and they are exophytic. Exophytic is something growing outward. So exophytic papillary lesions of epidermis, so mainly is of epidermis with parakeratotic spires. So remember again those terminologies, parakeratosis. So there is parakeratotic spires, hypergranulosis. Remember that layer? Yeah. So it means that layer increases in size, and occasional coilocytic cells. And then the epidermis proliferates in viral warts. Yeah, and probably you've seen somebody with a wart, probably you've suffered from warts at some point, and they are nearly always benign. So it doesn't mean it's always benign, but nearly always. Personally, I've not seen a wart that became malignant. So nearly always benign. And usually it's caused by human papilloma virus, HPV infection. I think we talked about HPV at some point when we were talking about cervical cancer, for example. We say this is another virus also that is thought to cause cervical cancer. And even the other day when we talk about male reproductive system, we talk about this human papilloma virus could be causing penile cancer, for example. Yeah, and this one occurs in non-traumatized skin. So the skin has not sustained any trauma. That is, the skin was not injured by anything, it was just intact. So occur in non-traumatized skin. And then it can affect any part of the skin. But when it affects the plantar, remember in the foot, the part that comes directly with maybe the ground and so on, that is the plantar region. And then the upper part is the dorsum. So the one that tend to affect the plantar region where you're stepping on, they tend to be inverted. That means they tend to turn inward instead of coming out. Because of course you would expect, because you're always in shoes, you're always stepping on the ground, so it will not have an opportunity to grow outward. It will not become exophytic like the rest, but it will tend to grow inside. That is what we mean by inverted. So plantar warts tend to be inverted. And usually they tend to become symptomatic. That is one of the things that patients come with plantar warts is they come with a lot of pain sometime when they are walking, because that wart is growing inside into the tissue. So they start developing pain, and sometimes we've had to actually excise them because the patient is in a lot of pain with these plantar warts. And usually they are spread by direct contact. That means if you meet somebody, if you greet somebody with warts, it's likely to spread to you and you start developing warts. Yeah, and mostly tend to affect the hands, the face, and even the soles of the feet. And we have there a diagram, a histological diagram of verruca or wart. And you can see the hyperkeratosis, you can see the parakeratosis. So go back and revise again those terminologies, acanthosis, papillomatosis, and you can see those vacuolated cells. We call them coilocytes. Vacuolated is it has a fluid. There are vacuoles. Vacuoles is a fluid filled area, almost cyst. Yeah.